Hi and welcome to Pebbles channel. So we were talking about safety and first aid. As we see, accidents are mainly caused due to carelessness. We can avoid accidents if we are more careful and more cautious or alert. In the case of an accident, in spite of being extra careful, then steps should be taken to see that the injured person receives immediate medical help before being taken to the hospital. The immediate medical help given to an injured person is called first aid, and it is very important to keep or maintain a first aid kit, be it at home or in school or in the working areas. First aid is very important. We're going to talk about the different types of injuries and how we can use first aid. The first and most important is burns. Burn is an exposure to extreme heat or flame, and they can be either minor burns or severe burns. In the case of minor burns, what first aid can be taken? If the burn is minor, we can place the burnt area under cold running water until the burning subsides, and then apply a layer of dough if it is available in the refrigerator for the burning to subside. Once the burning subsides, we need to apply an antiseptic lotion to the burn. In case the burns are severe, you will see that blisters starts to appear, and when the blisters form, we know that the burn is severe and we should not prick or touch the blister, because if we prick the blister, then it becomes an open wound and is liable for infection. So we need to apply an antiseptic lotion over the blister and then wrap it with a sterilized cloth to keep it secure. So these are all the first aids that can be rendered in case of burns, whether it is minor or severe. Moving on to our next, it is in case of chemical burns. So our next topic is in case of chemical burns. Chemical burns should be treated only by a doctor. As we have already seen earlier, even severe burns needs to be treated by a doctor once the appropriate first aid has been given. In case of minor burns, it is not necessary to go to a doctor. We need to just treat the burnt area with cold water or dough and then apply an antiseptic lotion. But in the case of severe burns and chemical burns, it needs to be treated by a doctor. For severe burns also, we can give first aid and then take them to the doctor. But where chemical burns are concerned, they need to be shifted immediately to an hospital. Before the arrival of a doctor, clean the affected area with plenty of water and keep the area covered by a clean cloth. So the first point, in case of treating of chemical burns, we need to treated by a doctor only, and before the doctor arrives, we need to clean the affected area with plenty of water and keep the area covered with a clean cloth. So these are the first aids that can be given in case of burns. So burns are nothing but an exposure to heat or flame, and in case the burn is minor, we need to put the burnt area under cold running water and apply a layer of dough if it is available in the refrigerator. Then we apply an antiseptic lotion and over the burnt area. In case the burns are severe, then you find blisters appearing, and it is very important that we should not prick or touch the blister, because once we prick the blister, it becomes an open wound and is liable to get infected. Then we need to apply an antiseptic lotion and needs to be sent to the hospital. In case of chemical burns, the patient needs to be sent to the doctor immediately. Before the doctor arrives, we can give normal first aid, that is, clean the area with plenty of water and keep the area covered by a clean cloth. So these are the first aids that can be taken in case of minor burns, severe burns and chemical burns.